At Wellstar, we believe in heart. Within the Wellstar Cardiac Network, our goal is for heart disease to be prevented, diagnosed, treated, and rehabilitated close to home with the people, tools, and outcomes that are truly world-class. Join us as we take a virtual tour of Wellstar's cardiac diagnostics and our rehabilitation program. We'll walk through the Admit Recovery Unit, catheterization lab, and telemetry floor. We'll also meet cardiac physicians and rehab staff, as well as patients who have had similar experiences as you. We will end our tour in Wellstar's cardiac rehabilitation program so you can experience all the opportunities we have to offer Wellstar Cardiac Network patients. So come on, let's get started.
Once you are back home, it's important that you include exercise as part of your daily routine. Exercise has been proven to result in less trips to the hospital. We would encourage you to attend our free HeartSmart class with your family. This free education class is taught by our cardiac rehab team, made up of registered nurses, exercise physiologists, and a dietitian. In our HeartSmart class, we'll talk about signs and symptoms of heart disease, risk factor modification, exercise guidelines, and activities to reduce your risk and build your exercise tolerance. The dietitian will provide you with heart-healthy guidelines to incorporate in your daily meal plan. We also talk about reading labels and portion sizes. The free HeartSmart class is a great opportunity to also hear from cardiac professionals as well as other patients that have had similar experiences as you. This class is offered at various times and dates at Wellstar Kennestone, Cobb, and Douglas hospitals. Outpatient Cardiac Rehab Program. After you leave the hospital, your doctor will refer you to our Outpatient Cardiac Rehab Department. Cardiac Rehab is a medically supervised program of exercise, education, lifestyle modification, and emotional support. Usually, cardiac rehab is recommended following a heart attack, bypass or valve surgery, angioplasty or stents, or for patients with angina. Why participate in Wellstar's cardiac rehab program?
I haven't had a patient that I referred for cardiac rehab that didn't come back and thank me for getting them involved in the program. First of all, when they get out of the hospital, they're very afraid of what they can or cannot do. And if they're not afraid, their spouse and family are even more afraid. So they tend to want to go very slowly than they probably need to. But if they're in a monitored setting such as cardiac rehab, then they have the freedom to try and push themselves knowing that there are cardiac nurses, cardiac exercise specialists right there that can answer any questions or concerns that they may have as they develop while they're exercising.
When I came in here, they just were so warm and made me feel so good because you're still kind of scared. You know, you've got the big cut in your chest and you're not sure if something else is going to happen to you, but they just reassure you, and it was wonderful. It was just, they always made me feel good, and I just completed the cardiac 2, and I just couldn't leave him yet, so I'm going into cardiac 3. You still want to stay around. You just know you're being taken care of, and you know they care about you.
Rehab, without the folks here to motivate, to talk about the nutrition, to just check on you, I don't think recovery is going to take place. You know, I think we're blessed that the doctors are able to go in and treat us and give us the tools, but then it relies on me to use those and take advantage of them. And the rehab program, while it's hard to make it fit your schedule, it's worth it. And I know I'm going to benefit from it, you know, for the rest of my life.
It has been shown to reduce the risk of a fatal heart attack by 25%. Angina sufferers experience less severe symptoms and rely on fewer pain-controlling medications. Cardiac rehab participants visit the emergency room less often and enjoy 35% lower costs for doctor's visits and hospitalization. Cardiac rehab and education helps lower blood pressure, emotional stress, depression, and anxiety. Cholesterol and triglyceride levels decrease after participating in the program. Cardiac rehab will improve your quality of life and give you the self-esteem and confidence to live a long and healthy life. Here's what to expect in Wellstar's outpatient cardiac rehab program. Their prescribed exercise program meets 3 times a week. You will be supervised while exercising. Your heart rate, blood pressure, and heart rhythm will be monitored on a screen where a doctor, cardiac nurses, and exercise physiologists will closely follow your progress. The Rehab program allows the cardiac rehab staff to communicate regularly with your cardiologist so that he is part of your recovery as well. You will receive education so you understand and can conquer heart disease. Free dietary consults provided by our registered dietitian will be available to you while you're enrolled in our program. Our staff will help determine your eligibility and work directly with your insurance. Insurance companies may cover some, if not all, costs associated with the program. Financial assistance may be available if needed. Best of all, this program will empower you to be able to live a healthier lifestyle by knowing how to choose heart-healthy meals, reducing your risk factors, exercising regularly, and making these choices a part of the rest of your life. Wellstar offers free classes and support groups for you and your loved ones. Please visit our website to see what other opportunities are available. At Wellstar, we believe ailing hearts can be mended, and we believe in life well lived.
Thank you for joining us on this virtual tour of the Wellstar Cardiac Network's Diagnostic and Rehabilitation Program. We hope it has given you a glimpse of what to expect throughout your procedure and rehabilitation, and ease any concerns you may have. At Wellstar, your heart's in good hands.